Pardon. Again, my name is Stephen Lawton. I'm the Senior Lead of Communications for the McMaster Health Forum. The forum's mission is to harness the best available evidence, convene concerned citizens and influential thinkers and doers, and prepare action-oriented leaders to meet pressing health challenges creatively. Now to the reason that we're here. We're fortunate to have three great speakers with us today. Gai Moore is a Principal Analyst Knowledge Exchange at the Sachs Institute, where she has led work in the development and delivery of knowledge exchange services for health policy and practice agencies for more than 10 years. Gai is completing a PhD in knowledge translation, which has examined several aspects of how the Sachs Institute's evidence check rapid reviews are used by policy agencies. Gai brings her substantial previous experience in the health sector in health services management, education, and training to her work with policymakers, program managers, and researchers to advance the use of research in decision-making. Jo-An Atkinson leads a program of work in partnership with health departments using dynamic simulation modeling methods as evidence synthesis and decision support tools to inform policy and program planning for the prevention of complex public health problems. She has more than 15 years experience in health service delivery and clinical research in Australia, as well as in public health operational research to inform strategic planning for disease control and elimination in the Asia-Pacific region. Her research interests have included exploring human behavioral and system influences on intervention effectiveness, exploring acceptability of new and existing technologies for disease prevention, and the design of strategies for community engagement in prevention initiatives. Michael Wilson is the Assistant Director of the McMaster Health Forum and leads the forum's rapid response program. He also helped to lead the development of health systems evidence and continues to use it to conduct knowledge syntheses, including evidence briefs, citizen briefs, overviews of systematic reviews, and rapid syntheses. Welcome to all three. We'll start with an overview from Gai and Jo-An of the evidence check program and the appetite for the use of evidence in policy development in Australia. They will then share their top 10 insights into implementing a rapid synthesis program to support evidence-informed health systems. Mike will share his thoughts, and then we'll open the webinar to questions and answers. But now, please welcome Gai Moore and Jo-An Atkinson.
Thank you very much, Steve, and hello, everyone. So our topic today, we're looking at the top 10 things we've learned about knowledge synthesis over our decade of running the program here at the Sachs Institute. Okay, so just to give you a brief background about the Sachs Institute and a little bit about how the synthesis program was developed, so that when you're listening to the top 10, you've got a little bit of context in which to place them. So the Sachs Institute was founded in 2002, and it's an independent, not-for-profit organisation whose mission is to improve the health and well-being of people by driving the use of research in policies, programs, and services. So we work with about 80 or more policy and program agencies and over 46 public health and health service research groups and universities in New South Wales and around Australia. We have been developing and testing systems and services to increase the use of research, working in partnership with government, non-government and research organisations. So when the Institute was founded, there were 3 people in that first year. And when I came on board in 2005, we would have been about 12. And now there are more than 80 people in the Institute. So you can hear the rapid growth that we've been through. Okay, so just to give you an idea of some of our activities that are happening here, we work with agencies to define their research needs. We develop agency capacity to use research. We build and strengthen partnerships to undertake research. We manage a lot of infrastructure and data linkage, and we continue to develop and evaluate new services and programs. So why synthesis? In the formative research that was conducted early on in the Institute's development, it became very clear that policymakers were actively seeking research, and the researchers were very keen to engage with policymakers. And in that detailed initial needs assessment that we conducted, one of the priorities for the policymakers was that they could access existing research and use it in their policy processes, And on that basis, Evidence Check, which is our rapid review program, was established. And since then, we have continued to develop a range of services around that, which we have in place to make the use of the findings in the agencies who commission the work more effective. So one of the innovations that we'll be talking to today, or Jo-An will be talking to, is about dynamic simulation modelling, a new form of synthesis for us. So Evidence Check was piloted in 2005 and established in 2006, and it follows a standardised review process that takes about 10 to 12 weeks to complete. So since that time, I think we're now over about 230 rapid reviews have been commissioned. And the people that we work with in this process are the policy and practice agencies who want to use the research, our external review teams, so we don't conduct the reviews internally, our pool of knowledge brokers, and I'll talk a little bit about their role in a minute, and our liaison team, or people like me who are the intermediaries that provide support to the policy and the research teams throughout that rapid review process. Okay, so just to give you a feeling for what these rapid reviews are and what they look like, they can range from 10 to 40 pages in length. They can address clinical issues, health economics, population, public health, and they all have a standard executive summary that's not dissimilar from the 1325 that was developed in Canada. That's just some examples of the covers of our reviews. You'll find them all online, and when you have the slides, the link is there at the bottom of the slide. Excuse me. So the top 10 things that we've learned about synthesis. I'm just pausing to drink some water here. Okay. So here are our first 5. Policymakers value research. Agencies use research, but in different ways. The right evidence isn't always available. Getting the review question right is key. We've found that knowledge brokering does make a difference, and you need the right synthesis team on board and the right supports in place. You can increase the use of research, but measuring impact is difficult. And trust, we think, is the essential ingredient underpinning the process. Okay, so this first slide comes from our CIPHER study. So the CIPHER is an NHMRC funded Centre of Research Excellence, and it's a collaboration that's international across 7 different university groups, including St Andrews in the UK. And the CIPHER study is a intervention program that was rolled out across 6 agencies over 5 years. And this slide's just a snippet, really, so you can see the high level of agreement across those 6 agencies with the value of research to inform policy processes. So agencies use research. We've been able to track 153 of our rapid reviews and how they were used, and we know that 96% of those reviews were used by the agencies who commission them. But what's particularly interesting is the differences in the way that these agencies work. So the apples here on the slide that you can see, they represent government agencies such as Treasury, who have higher level direction, responsibility for the direction of multiple portfolios. The oranges in the slide are government agencies with a single focus, and that would be, for example, health or housing or education. And the bananas on our slide here are the non-government agencies whose needs you would think might be quite different. And the 2 lines that you can see are just to highlight some of the differences. In some cases, the differences were quite acute, but even when they're a little bit less dramatic, as you can see in this slide, the way that agencies use research is different. And our research is indicating some of the reasons why that might be so. It could be, we think, associated with the mandate of the agency, so why that agency was founded and the focus of their work, and possibly their role across a range of other agencies within a particular jurisdiction, for example. And obviously different agencies might focus on policies or programs or practice and the particular outcome that an agency wants from any individual piece of work. So agencies use research in different ways. But top 10 message number 3, the right evidence isn't always available, and I'm sure you'll be very familiar with that scenario. So our policymakers tell us that they still find a lack of timely, relevant research, and that it can be very difficult to apply the available evidence to a local context. And what the policymakers tell us that they need are syntheses and summaries of research in user-friendly formats with key messages highlighted in a way that prompts action. Number 4 of our top 10, getting the synthesis question right is key. Or to state the deadly obvious, to get the right answers, you need the right questions. But policy agency questions can be very broadly described and are very much situated in the policy world. So sometimes the agency questions may not adequately reflect the agency's information and research needs, for example, or they may not be sufficiently specific to carry out a review, or they may be questions that actually can't be answered by research. So getting the question right is harder than you might think. So key message number 5 for us is that we've found that knowledge brokering makes a difference. And what we mean by knowledge brokering here is very specific to the rapid review process. So our knowledge brokers are very senior researchers who've had long experience and engagement with policy agencies. And they come together with the commissioning policy team to really clarify what they're going to need, what they need their synthesis to do. And here are some of the activities that they would be doing during that 1-hour session. So they're trying to unpack the review questions with the policy agency, to clarify what's needed and define key terms, and to reconstruct the questions and refine them from the reviewer's perspective, and then to check the fit with the policy purpose and context. Okay, so our qualitative work has shown us that the agencies do find this helpful, and you can see this particular quote on the screen at the moment. What the knowledge brokering session did for us was tease out specifically what those questions were. It gave us an opportunity to really work out what we really wanted and maybe to push away some of the extraneous stuff that wasn't particularly pertinent or relevant. So we then designed a before and after study to see if we could sort of demonstrate quantitatively whether or not the knowledge brokering was effective. And what we found after that study was that the synthesis briefs were significantly clearer in their statements about the purpose, in their review questions, in the scope and the methods, and in the instructions on what should be included in the final report. And our reviewers who were participating in that study were significantly more confident that they could meet policymakers' needs based on the information in that brief. So knowledge brokering does make a difference. But our 6th message of the top 10 is that you really need the right synthesis team. Now, our synthesis teams are external to the agency, so they each have the opportunity to put together the range of expertise that is right for any particular review. But what we're looking for generally is high-level content expertise, because The syntheses are rapid, so people need to be fundamentally at home in their field to be able to respond that quickly. We're looking for experience of conducting literature reviews because the rapid reviews are following a systematic process. We look for the ability to synthesize multiple sources of evidence or types of evidence, and a very sound understanding about policy environments and policy needs. And the essential last skill in writing well for policy audience or whoever the audience for that piece of work might be. You definitely need the right team. And you need the right supports in place, so good people and good systems. So the liaison team or the intermediaries who are involved in this process, their job is to manage the overall progress of the work. And some of the things that they're focusing on would be ensuring that the process of the rapid review and the roles of the participants are clear, bringing people together to facilitate interactions at key decision points, reviewing the quality of the synthesis once it comes in, and really supporting the reviewers to write up their findings in a policy-friendly way. In addition, of course, we're facing every time the contracting issues across agencies, negotiating intellectual property, and sorting out what the publication rights are at the end of the process. So the right supports in place. So our 8th message of the top 10 is that we think you can increase use, and we have developed a number of strategies around our rapid reviews to try to do that. We offer the agencies the opportunity for the research team to present their findings to the policy team internally or also to external stakeholders. We develop targeted summaries, so if you have a very technical report or a policy high-level report, we can write the key messages into a summary that might target practitioners, for example. We offer policy dialogue, so these would be face-to-face confidential meetings or discussions that are facilitated by a broker that give the policy agency the chance to really work with the researchers on what those findings might mean as they try to move forward within the agency. We also convene and facilitate consensus building processes and workshops and forums, pretty much according to need. So number 9 of the top 10 is that impact is hard to measure. And again, I'm sure that's very familiar to everyone working in this kind of field, because policy contexts are complex and change is incremental and can take time, so the impact might not be immediately obvious. And our syntheses are just one input into the policy process. And if you cast your eye over that grey shaded area, you can see the number of influences that our policy teams say go into any decision-making process. But despite that, we do have evidence of impacts for a number of our reviews, and these are just a few examples to give you a sense of what that might look like. So some, for example, we have seen have been setting priorities for funding interventions in cancer, for example, or in dementia care. Another kind of impact has been promoting best practice in generating and using research. So this has been a series of policies and guidelines that have been made available to policymakers and practitioners to kind of promote best practice in that field. Or another kind of impact would be around aligning social marketing messages with the latest findings from research. And I'm thinking here of our work, for example, in drug and alcohol campaigns, and another group in men's health. All right, clicking on the wrong button here. Okay, so number 10 in our top 10 is around trust and the partnerships that we form. Respect and understanding are essential to that process, as is a shared commitment to the policy goal. And because our teams are often not known to each other when we bring them together in this process, trust in the first instance might be invested in us as the intermediaries. We foster, or it's about fostering open communication among the participants all the way through. And I have to say, policymakers, ability to be frank and to freely discuss what their constraints are and what the issues are that they're facing has been surprising to me, as has the high degree of responsiveness that we find in our researchers. And when you've got those two good teams, you can actually almost hear the researchers acutely listening to what's required and how that might play out in a rapid research review, because they're really keen to make that difference and to be able to bring research into the policy domain. So what we often find is that the partnerships that we build throughout the rapid review process thrive and are sustained beyond the life of the synthesis itself. And that for us is a great outcome. So I'm just going to hand you over now to Jo-An, and she's going to talk to you about a new method of evidence synthesis that she's been developing in the Australian Prevention Partnership Centre. Okay, Jo-An, over to you.
Thanks, Gai. The Sachs Institute is host to the Australian Prevention Partnership Centre, which is a national collaboration of researchers, policymakers and practitioners who are working together to identify new ways of understanding what works and what doesn't to prevent lifestyle-related chronic health problems in Australia. And one stream of work of the centre is focused on exploring new methods for evidence synthesis to inform policy and planning for more complex problems. Oh, sorry, we just got to change the slide. So in particular, we're using dynamic simulation modelling as a platform for synthesizing diverse and disparate evidence sources into, So for those of you that are not familiar with the term, dynamic simulation models are essentially computer models that are simplified representations of the real world. They provide us with a way of mapping and quantifying a complex problem by bringing together diverse and often disparate evidence sources, including research evidence, expert and local knowledge, practice experience and data. And the resulting dynamic model can then be used as an interactive what-if tool to test the likely impacts of different combinations of interventions over the short and long term before they're implemented in the real world. Recent advances in modelling software capability and more user-friendly interfaces have meant that dynamic simulation modelling is now more accessible to a non-modelling audience, and this has really allowed us to embed stakeholder engagement, participation and consensus building processes into the development of these simulation tools. And this has the advantages of being able to achieve a more robust tool and facilitate cross-disciplinary learning and communication. And despite being really an alternative approach to evidence synthesis that we're really using to support decision-making for more complex public health problems, we've certainly relied on the valuable lessons learned from the Sachs Institute's knowledge exchange team to establish and implement our processes. So I won't take up any more of your time, but if you're interested in more information about this stream of work, there's a link there on the slide to our website, or you can contact me for further information.
Thank you, Jo. Mike, I think it's back to you.
Great. Thank you very much, both Gai and Jo-An, for this. That was a fantastic presentation. So the idea is just I'm going to provide some additional insight from some of the work that the McMaster Health Forum does. We haven't been involved in this rapid synthesis area for nearly as long as the Sachs Institute has, and they have a lot of experience in this area, so we're a little bit more new. And our program at the McMaster Health Forum, a rapid response program, is focused on health systems questions. So the Sachs Institute is able to cover a lot of ground that we aren't able to, but our focus is on addressing questions related to governance, financial, and delivery arrangements in health systems. And I guess one of the ways in which I think our program is unique is that we can often turn around syntheses in very short periods of time. We say on our program description that our timelines for 3 different types of syntheses are within 3, 10, or 30 business days. So in reality, from those 3 timelines, almost all of the syntheses we get requested are in the 30 business day time frame. I think we've only had 1 or 2 in the 10-day time frame. And we've heard informally from ministries of health across Canada that it's unlikely to probably get requests from in the 3 business day time frame, because those working in a Ministry of Health, for example, would likely do that type of work internally themselves rather than turning to an external group. So when they're turning to us, they're more looking for a more in-depth synthesis that we're able to pull together. So within those timelines, what we're able to do, if we were to do a 3-day synthesis, we would leverage our database called Health Systems Evidence, which is the database that houses all the systematic reviews in the world about health system arrangements, so governance, financial, and delivery arrangements. So essentially, all the evidence about how to get program services and drugs to people who need them, but not necessarily about the program services and drugs themselves. And we are able to use that database to very quickly identify any systematic reviews that exist about the question that's been posed to us, and would provide essentially an annotated bibliography within 3 days. And then in 10 days, we're able to do the same and provide all the quality appraisals of those reviews that are already done as part of health systems evidence, but provide a short summary of the key findings from those systematic reviews addressing the question. And if we're given the 30 business day time frame, then we can do all of that. So the identifying the reviews, pulling key messages from them, appraising the methodological quality of the reviews, and doing a summary. And then also just make the summary much more in-depth and provide just a bit more detail about the nature of the interventions or approaches that we're evaluating. And so one piece that is really important from what Gai and Jo-An said, Joanna said, was the importance of getting the question right. So I very much agree with that piece, that the success comes from making sure that we're answering a focused question that is researchable. So after all, this is a form of trying to support the use of research evidence, so we have to be looking for things that people have investigated through research questions and getting that evidence. So we do spend a lot of time with those who request our rapid syntheses to be able to make sure the question is focused and that we're able to find information for them based on what they need. I would say another important point is from the top 10 is related to that there isn't always evidence out there. So the process has to be flexible to some extent, and I'll draw an example of a synthesis that I've just finished this week at the forum for the British Columbia Ministry of Health. So we were asked to engage in a process to try and identify some information around structures and processes to advance quality in health systems. And essentially they wanted to know about how different quality councils have done things and whether they've had an impact at the system level. So a lot of that is actually very hard to find in the research evidence, because what they're interested in was mostly gray literature. So we ended up, instead of going to more focused systematic reviews and other studies, going and doing a jurisdictional scan. So that one was very different than a synthesis we've done in the past. So I think it's always important to have that question in mind, and then to be matching what you're looking for to be able to answer that question and to provide that evidence support in a way that's going to be most helpful. Because the ultimate goal here is that this is very client focused. We want to make sure that we're getting the types of evidence to people who need it to answer the questions. And some additional points that I wanted to raise before I turn it over for questions is Well, the first is just that rapid syntheses, and I think this came up in Gai and Jo-An's talk, is that rapid syntheses are part of really a menu of options that can be used to support the use of research evidence. So they're great in circumstances where a policymaker needs something in a relatively short period of time, and then we have at the forum have the expertise to be able to turn around the research evidence related to health systems related questions, because we sit on that database of health systems evidence. But if we have longer timelines, then there are also other options. So the policymakers themselves can, if they have more time, can turn to health systems evidence themselves and identify the research evidence. So we usually call those a one-stop shop for research evidence. And we can also do things like, at the forum, we often convene citizen panels to identify citizens' values and preferences for different policy options, or convene stakeholder dialogues, which both Gai and Jo-An discussed in their presentation. So the notion of not only using this evidence synthesis to send it off to policymakers to use and inform their work, but then to also convene those engaged in the policy development process and have a deliberation about what we can do based on both the research evidence as well as the views, experiences, and tacit knowledge of those engaged in the system. And then there's also the piece around capacity building. It's very, all of this is great, but there also has to be a capacity building process in place to help those working in policy and in governments and in other stakeholder organizations to continuously build their capacity to find and use research evidence. One of my other points was also just about the importance of leveraging resources from those other options. So at the health forum, our main option is to leverage health systems evidence, and that lets us to be able to very quickly identify the systematic reviews relevant to these questions. If it wasn't for that database, then I'm not sure that we'd be able to turn around syntheses as quickly as we do. And then I'll finish just with some examples of impact of our work. So our rapid syntheses are typically requested by knowledge users either in Ontario in Canada or in other provinces of Canada, and that's increasingly been the case. And they often come from either the Ministry of Health or from other stakeholders, like we've conducted several for the College of Physicians and Surgeons of Ontario, for example. And so some examples of impacts are with the College of Physicians and Surgeons of Ontario. I think we've done roughly 3 or 4 rapid syntheses for them now on a range of topics, including educational processes to inform clinical decision making, as well as risk and protective factors for clinical practice. And we know informally that they've helped inform their policy development internally. As we heard earlier in the top 10 discussion, that that's very hard to document, so it's difficult to measure the impacts of these types of interventions. We've also had an impact in the suicide prevention strategy in Toronto. Our tables that we created for rapid synthesis on interventions for suicide prevention were literally taken and put into pieces of the City of Toronto's most recent suicide prevention strategy. So that was a very direct impact that we saw with that. And we've also recently done some work for British Columbia around identifying the impact of different approaches to better supporting mental health. So we know that informally that's supporting their internal processes to develop policy. So I can leave it there and open it up for questions. I just wanted to give you a snapshot of the forum's approach. I think they're both very complementary, and it's so great to see many new rapid response programs coming up, and the Sachs Institute has really been a pioneer in this area, so I'm really happy they were able to join us today.
Great. Well, thanks very much, Mike, and also to Gai and Jo-An. Those are both very, very interesting presentations with a lot of really, really great points there. I see we've got a few questions coming through in the chat window. So if anybody else has other questions, feel free to type them into the chat window, and we'll address them as we go. Bianca asked the first one, and she asked whether there was any thoughts on the tension between pertinent policy questions and the need to work with a well-scoped question in order to do good review work. How to strike a good balance there. So if either one of you want to field that one.
Jump in. It's a good question, because the wording of the question has to be appropriate for both the policy team and for the review team. And possibly our questions maybe err slightly on the policy side. So they have to, the policy team has to be able to see that they're going to work for what they want. But what we do then is provide a very detailed scope of the question. So what the key terms are, what the inclusion and exclusion criteria are, population subgroups of interest, and so on, so that the researcher has good guidance about what to build around each of the questions that are there. Jo, do you want to talk to that one?
No, I think there's
no. Okay. Steve.
Anything to add to that?
Yeah, not much to add. I agree that it's, the tension is there between having to have a very focused question that's researchable and the real world questions that might be asked from a policy shop in the Ministry of Health. I think that we can strike a balance between, being very broad and getting into some of the messy pieces and being very focused. But, in this work and doing things so quickly, the tension is always between what can we do with the time given to us. So that's always the question that I pose to a requester. If the question is very broad, I'll say, that might not be necessarily feasible. So what are the really key insights that you want that would be most helpful for the policy that you're working on at the moment? So that's usually my guiding frame.
Great. And Kelly asked a question. She asked whether you finish reports with recommending areas for further research.
This is Gai speaking. Look, it's always a difficult question, and the answer is it depends. So our reports don't generally end with recommendations because the policy agencies often don't want them or need them. They can work those, that level of information and direction for themselves. But we do usually discuss the implications of the findings. So what they might mean for decision making going forward. So it's a slightly nuanced difference between recommendations and implications. Most of our agencies do want us to identify the gaps in the evidence. So there's a section around what we do know and what we don't know about any particular question. And agencies may specifically want to know what they should be investing in for future research. So that's part of their agenda and part of their plan going forward. Or it might not be on their agenda at all. So the gaps would be noted. And the recommendation about future research depends on the constraints and the focus of the policy process. Jo, would you like to talk to that one?
Thanks. Yeah, that's a good point. And for us, when we're building dynamic simulation models, we also kind of avoid making any recommendations for policy actions. We see our role more as facilitators of a process of model development and synthesis of evidence and that learning process. But what we do tend to highlight at the end of the process is what the modelling reveals to us in terms of where the leverage points are in the system. So where you can make smaller impacts and intervene in certain areas and have greater than anticipated impacts. And also highlight some of the synergies when we're combining interventions or we're running policy scenarios and experiments, that we can show how when you combine certain interventions, they can have a synergistic effect. And so we just like to highlight some of the key learnings of having built a complex dynamic model. But we certainly refer the recommendations. The recommendations really come out of a dialogue that occurs with policy partners and their stakeholders interacting with the model and learning from the outputs.
Great, thank you very much. And Mike, did you want to add anything to that?
Yeah, so in our model, we never provide recommendations in our reports. It's very much just a presentation of the evidence that we're able to find and a synthesis of the key findings from it. And we do the same in when we write things like evidence briefs to inform stakeholder dialogues, that it's focused on presenting the evidence and not providing recommendations. I guess part of it is that because of the breadth of the questions that we receive, we feel as though it wouldn't be appropriate probably for us to be able to provide evidence, because and I think if we had more content experts on board, then we might be able to do that. But it's often the case that we're kind of working across many different topic domains, so that's the rationale on our end.
Great, thanks. And Bianca has another question, which I guess is a little bit more for Guy and Jo-An, but certainly all of you can feel free to weigh in. But she asks on which says that the focus has been very much on policymakers' interest in research, but asks, what experience have you gained from working with agencies, working with practice provision and service delivery? Has the Sachs Institute worked much in this field? And if so, are there differences in the work compared to what you normally do with policy people?
This is Gai speaking, and that's a really interesting question. We do work with practitioners. I'd say probably the majority of our work in the initial few years was with policy agencies, but we work more and more with practitioners, including clinical networks, for example, that go across our region. And it is different. It's the same process, but the contexts in which people are working is very different. So the questions around applicability won't necessarily be the same. And the people who come to the sessions are also different. So there'll be a cross stream of practitioners and policymakers. So it's a different sort of process to make a review work for that kind of combined audience. And the questions have to address, the experience of both types of people there. I think that the content is also different. They may want to be, the practitioners might wanting to be including local evidence, for example, or even experiential evidence. So I don't know that the process differs very much, but the content and the way that the report might be presented will be different for those reasons. Jo-An, is that something that you found?
Yeah, from a modelling perspective, the work of the prevention centre has really been focused on the prevention and public policy side of things, and the building of those sorts of models are quite an intensive process. So it's really only used for answering some of the big policy questions. However, and that's just been related to the work we've been doing at the Prevention Centre, but there are, very experienced expert modelers working with us who have done, you've been working for 20 years answering questions about service delivery and improving efficiency and optimizing resources and that sort of thing. And they use a different, they use what's called discrete event simulation, which is really just a process-centric type of modelling that can answer some of those questions. So it's more that they would use a different modelling tool depending on the question being asked, and the process. There are similarities across the processes of implementing that work, but they're a little bit different.
Great. And Mike, did you have anything you wanted to add into that question?
No, I think that's good. Thanks, Steve.
Okay, it looks like Kelly is typing a question, so we'll just wait a minute. But while we're waiting for some other questions to come in, I just thought I'd highlight some information about some of the forum's rapid response program. As Mike mentioned, the rapid response program that we offer comes in 3 sort of versions of timeframes and responds to urgent requests from policymakers and stakeholders. And then this is just some other relevant resources from the forum. So if you're interested in checking out our program or want to check out any of the issue briefs that we have done in the past, they're all on our website. And if you have any other questions, you can always email us at mhf@mcmaster.ca. So Kelly asked Mike if you can please describe your process for quality appraisal of research.
No problem. So we use the Amstar tool, and so that tool assesses the methodological quality of a review. So what it doesn't do, unfortunately, is assess the strength of the evidence contained within the review, and it's reliant upon what's reported in the publication or the report of the review to be able to gauge how well it was done. So for every single systematic review that we index on health systems evidence, we also provide an Amstar score for each of those systematic reviews, which lets us be able to include those quality assessments very rapidly and within the time frame of days or weeks, like we do with our rapid response program.
I'd just like to say a quick thank you to Guy, Jo-An, and Mike for joining in on this webinar. We really appreciate it, and I think it's been a very useful discussion. I see Marge now has typed, she's asking Mike, what key things have you learned about how policymakers want the findings of syntheses communicated back to them? So Mike, you can maybe answer that first, and then Guy and Jo-An can add in some of their own insights.
Sure, no problem. So I think these are the it's to keep it simple and to provide that graded entry format to always start off with the key messages first and to be clear about the questions were and to present the evidence in a way that avoids being too technical and that just gets to the bottom line as much as we can. So I think those are the big things. So it's always being brief, being to the point, and letting them know where we're relatively certain about the evidence and being clear when we don't know or when there isn't good evidence. So I think both sides of that equation are important.
I think that's our answer would be very much the same as Mike's. They want the independence, so they need to be able to separate what's evidence from what's opinion and make sure that that's clear during the report. And we too do the graded entry thing. I think that the executive summary is really the important part of the report because the people who are very busy won't read the entire document and need to be able to rely on that early content. And yes, and as I was saying before, if we need to, we can supplement that, or if the agency needs us to, by providing a practitioner summary or similar short forms of the review for circulation to particular audiences.
And I would agree with what Michael and Gai have said and add that what's been invaluable in our work and improving our communications has been the ability to work side by side with excellent communications teams that really kind of help us refine our language and our methods and make sure that really is plain language that's easy to understand.
Great. Well, thank you very much. I'd like to thank everybody for joining us today, and also again just to Guy and Jo-An and Mike for joining us today from Canada and from the other side of the world, from Australia. So it's been a real pleasure. We hope to do this again sometime, and like I mentioned, our next webinar will be Monday, December 12th, and we'll certainly be continuing the series in the next year as well. So stay tuned. You can follow the MHF Top 10 hashtag or just check out our Top 10 webinar series page for more information